Hello guys, welcome to Homeo Health Care. So today we are going to discuss on the topic irritable bowel syndrome. So before going into that, let's understand a basic anatomy and physiology of the GI system. So we will understand this disease very well. So, first the esophagus, then J-shaped stomach, then small intestine. In that, first part is the duodenum, jejunum, ileum, then large intestine, ascending colon, transverse colon, descending colon, and then rectum. So, what is the function, physiological function of these bowels, that is intestines? That is, there will be a peristalsis movement, and due to this peristalsis movement, the digested material from the food gets pushed forwards towards the rectum. With this motility, GI motility, peristalsis. So now, if this bowels gets irritated, that is irritations of bowel syndrome, in this there will be a change in the peristalsis, change in the GI motility of the bowels, change in the peristalsis movement of the bowels, due to which what can be things occur? Either there will be the more frequency of passing stools due to increased bowel movements, or due to decreased bowel movements, there will be the less number of passing stools, infrequent stools. But with this abnormal defecation, there will be also patient will experience abdominal pain, especially in the lower abdomen. उस जगह पे पेशेंट को पेन फील हो सकता है. So, what pathophysiology is behind this irritable bowel syndrome? There will be a behavioral or psychological factor, physiological factor, or luminal factor. So, what is this behavioral or psychological factors? In the many patients of the irritable bowel syndrome, it has seen that there is a stress, some disturbed mind, disturbed psychology, and some of those patients have gone in the psychiatric illnesses also. Depression, anxiety, excessive stress, excessive worriness. Due to these conditions, their peristalsis movement of the bowels gets disturbed. They don't remain in the normal condition. They will not be in the harmony due to this anxiousness, depression, sadness, or due to the excess level of the worries. So, what clinical features we are going to see, or we will see in such patients of the irritable bowel syndrome? There will be a three type of changes can be seen. First, diarrhea alternates with constipation. Second, diarrhea. Third, constipation. So, what changes will be there in the diarrhea alternates with constipation? Firstly, patient will having the loose watery stools, frequent motions, defecation. But after that, patient will suffer from the infrequent passing of stools. That is constipation. The GI motility, the peristalsis movements of the patient gets decreased. That means first increase in the peristalsis movement, that will be the loose watery stools, then decrease in the peristalsis movement, that is constipation. Then there will be a predominant constipation. That means the peristalsis movements has got decreased. There will be infrequent passing of stools. Patient will defecate less, and due to this, he will pass the pellets like stools. And along with that, he will experience the pain in the abdomen. This type of pain may be a crampy pain, colicky pain, and it gets ameliorated or get relief after passing the stools after defecation. That means amelioration after passing stools. This symptom also can be seen. Now, what is in the predominant diarrhea? There will be the increased peristalsis movement. Patient will pass frequently stools. These stools may be a loose, watery type of stools. And along with that, there will be the low volume of the stools. And frequently he passes. So now, whether there will be the diarrhea alternates with constipation or there will be only predominant constipation, predominant diarrhea. Whenever this irritable bowel syndrome patient passes the stools, the mucus will be present, but no weight loss is seen in such patients. After that, some patients may experience the bloating of abdomen. That means excessive accumulation of the gas in the abdomen. Due to this excessive accumulation of gas, the patient's abdomen gets bloated. This condition can be there. Patient will have fibromyalgia. Now, what does this fibromyalgia means? The patient will have pain in the muscles, in the different parts, not only in the same part. It is a widespread pain, and the most important thing in these patients, there will be no structural changes. No structural changes has been taken place in such bowels or entire GI system in the bowels. There will be no structural changes. This disease is at only the functional level. So what examination findings you will get in this patient? There will be no such examination findings that you will get encounter in every patient of the irritable bowel syndrome, because the symptoms are vague. That means a different types of symptoms in the different patient can be seen. But if a patient with the irritable bowel syndrome having the bloating of abdomen, then on examination in his on his abdomen, there will be we can see the bloating of abdomen. This condition can be seen, but not in every patient. So, what miasm can be there? If we see the pathology of this patient of the irritable bowel syndrome, there is like no structural changes. Disease is at only the functional level. So, in the SORA, there is no structural changes taken place. The disease is at functional level. So, this irritable bowel syndrome falls under the SORA miasm as there are no structural changes present. So, now what about its treatment part? In homeopathy, after taking a case, analyzing that case, what remedy comes up for the patient, that after administering him to him, which suits to the him, and after a course of treatment, he will not have the intensity of this disease as he was having earlier. जब कोई इरिटेबल बॉवेल सिंड्रोम पेशेंट की केस ली जाती है, उस पर वर्कआउट किया जाता है, उसके बाद में जो दवा ऊपर आती है वो उसे एडमिनिस्टर करने के बाद और एक पर्टिकुलर कोर्स ऑफ ट्रीटमेंट के बाद उसको उस इंटेंसिटी में वो कंप्लेंट नहीं रहती है जिस इंटेंसिटी में वो हमारे पास आया था. एखादा पेशंट ज्याला इरिटेबल बॉवेल सिंड्रोम आहे आणि त्याची केस घेतल्या जाते. केस घेतल्यानंतर ते कोणती औषध वर निघून येतं ते जेव्हा त्याला दिले आणि त्याला ते चांगल्याने लागेल ते औषध आणि एका कोर्स ऑफ ट्रीटमेंट नंतर त्याला चांगल्याने आराम पडेल आणि तितका त्रास त्याला राहणार नाही जितक्या त्रासामध्ये तो आधी आला होता. As we says, we treat the man in disease, not the only disease in man. So, if you like this video, subscribe to my channel. Thank you.